kind of the packed lifestyle now. So I think that I've been trying to go through, like, I think that teens have been trying to live their lives as they were before, and it's just so unrealistic. And I think that we need to try to encourage teens to maybe not go back to the old norm, but kind of focus on whatever their new norm might be. And I think that not putting the pressure on them to do it in one way is really important, because everyone is trying to push teens to do it one way when it's different for everybody. And so that is one thing that I've kind of been noticing. Yeah.
Thank you, Riley, and thanks for sharing. I will say it's so important for parents, the community, and teens to hear you say that as well, because many people thought, August, the kids are going back to school, everything will be back to normal. And saying, that no, it's really difficult. It's challenging. We're still trying to figure out what this new normal is so important for us to hear it, especially coming from a teen. So thank you so much for sharing. Next, we will have our third panelist, Dr. Sandra Escobar, who is with Ravenswood Family Health Network. Dr. Escobar, thanks for joining us. Dr. Escobar obtained her BA in psychology at UCLA and completed her doctoral in psychology at the California School of Professional Psychology, San Diego. Since 1995, Dr. Escobar has held several leadership and clinical positions working in community behavioral health programs, serving the neediest and most disadvantaged individuals in our communities. Her professional track record includes successful advocacy of an integrative approach to services, building community partnerships, implementing new programs, and advocacy for community, culturally appropriate, evidence-based clinical therapies, outcome-driven services, and clinical supervision for postdoctoral students. Before joining Ravenswood, Dr. Escobar was the Senior Division Director for a large nonprofit community organization providing leadership and managing a large-scale multi-million-dollar health division. Dr. Escobar.
Sorry, I muted myself. I actually have a cup that says I'm muted myself. Thank you so much for that introduction. I appreciate that. A little bit about myself. I was immigrant as a child, came to this country at a very young age, around 10. I'm from Central America, El Salvador. And since my career, my college career, I have been a community baby. I call myself a community baby. I have done anything but work in communities where underserved or unserved. And my passion is working with different groups, different minority groups, and try to have an understanding of the different issues in terms of mental health and the different stigmas that different groups have for mental health. I want to say something about the pandemic, which I think is really something very personal. I do have 2 kids. They're out of the house. They come back, but they're out. I don't know. They come in and out. But well, and then I'm also a lover of dogs, and I rescued a lot of pets, and I enjoy running, spending time with family. And I really love my work. I love being with people. I think that is helping me a lot, because all of us, we all have our burden in this pandemic. We've all are professionals. We're moms. We're sisters. We're friends, wives, partners, and so it's a lot going on. So you really have to have a passion for this type of work. One of the things that I do want to say about the pandemic is that my hope is that a lot of good, I know there's a lot of devastation and we're seeing it already, but there's also some things that I think might be helpful later on, like the stigma I do find a lot of folks coming in, for mental health services, and I think this is great. I don't know if there's anyone out there that can say it's unscathed and no mental health issues, right? From depression to anxiety to some panic to just different things that are going on. I think we all have to be very open and clear that this is okay. This is we got to get away from this is mental, and then you have this issue. No, this is okay. We're humans, so we're okay with that. Get that stigma out, and then try to get some help. Having said that, I am now, most of my work has been in LA County. I came to the Bay Area about 5-6 years ago, and I'm working now at Ravenswood Family Health Network. And in that role, I am the clinical director, and I'm also a provider. So I'm in a very unique role that I can see both worlds. I'm providing services as well. Most of the time to the most difficult cases that our department gets, I'm the one that has those cases. So a lot of the work that we provide in the at Ravenswood is really folks that are really don't have a lot of resources. So they were pre-pandemic, they were really struggling economically, and now with the pandemic, it's even worse. So having said that, I really think mental health services is a huge crisis. We really we didn't have the providers before the pandemic that we needed to serve the different populations with cultural and linguistic capabilities. Now with in this time, a pandemic, and during this time, I think this is going to be a long run for us. We're seeing a lot more need and not that many providers. So I'm very concerned about people getting access to services in a timely manner, because we know that makes a difference. But thank you very much. I'm looking forward to this conversation.
Thank you, Dr. Escobar. I think there's an echo, and you mentioned the stigma, and I was reminded of former First Lady Michelle Obama, sharing the fact that she had low-grade depression during the pandemic, and the reaction to that varied, but I think it was so important for her to share that so everybody understood this. It's okay, and it helps to share and to talk about it. So thanks for that, Dr. Escobar. I will get us started with our panelist questions. And Dr. Dami, I want to come back to you, and start off by asking about the types of symptoms that you're seeing of stress and anxiety. How do they show up in this pandemic? What are some of the things you're seeing? You're on mute, Dr. Dami.
Can you hear me?
Yes.
So when the pandemic started last year, I think it was a very sudden thing. It was a sudden disaster kind of event that unfolded and took us all by surprise. And I began to see the tremendous impact it had in terms of fear, stress, and anxiety. There was a lot of unknown, and science didn't have all the answers. And there was just a lot of fear, a lot of unknown. I also started noticing that people started having multiple losses. There was loss of connection with your family, with your friends. There was loss of sense of safety, loss of sense of freedom, and there was, patients lost their jobs, insurances, childcare. But the foremost worry was about safety, health, well-being for themselves and their families. And I think it just was this really big, unmanageable cluster of symptoms that then started taking shape and form as depression. Sometimes it showed up as increase in more substances. The early things I started noticing was that a lot of my patients started vaping, and I had a few younger patients who sometimes I would see through telehealth, and one of them was vaping during one of our meetings, and I of course said, we can't be doing this, but began to see an increase in substance abuse. So there was fear, stress, anxiety, increase in depression, increase in substance abuse. Early on, also began to see increase in reports of domestic abuse and violence. And I also a lot of my patients who had pre-existing mental health symptoms, who had severe mental health diagnosis, their symptoms were beginning to get worse. They because of isolation and lack of support network or social groups that they had, they could not access those services. So they began to have more and more symptoms and worsening symptoms. Some of the other things I noticed was the anxiety about childbirth. Women who were already pregnant were now really concerned about how their visits would go through, how they would have support during the process of childbirth, what the process of childbirth would look like, the fear of contracting COVID if they went into the hospital. So the answer to your question is I saw a tremendous increase in fear, stress, and anxiety, and I saw it take different forms. Sometimes substance abuse, a lot of times depression, increase in suicidal thoughts and suicide attempts, increase in domestic violence, increase in PTSD, and then worsening of severe mental illness like bipolar illness, OCD, psychosis.
No, thanks, Dr. Dami. And I do want to pick up on this question with Riley as well. You just shared about the social challenges you and your friends and that you're observing at school. And so I'm wondering, how are you seeing symptoms of stress and or anxiety show up among your peers at school?
Yeah, so I actually, to help me with these questions before, I kind of also consulted the counselor at my school and then a counselor at CHAC. So what they told me and what I've been seeing personally is that young women in particular have, like I said earlier, had an increased pressure to return to the normal. And a lot of this normal is the pressure to be put together. And so what I've been seeing with my friends in particular and people around me is distress over small things that normally maybe wouldn't stress them out as much. For example, I have a friend and she recently has been trying to get in a lot of her college applications. And of course, college applications can be stressful, but the parts of it where it's just putting in her name or maybe just putting in what activity she did have been stressing her out extremely. And things like that, normally pre-pandemic, I would never have stressed her out. So just small things have just been magnified completely to just seem like huge events. And I think that that's something that a lot of teens are going through, especially young girls when they're trying to return to this normal. And another thing that Anya from CHAC shared with me that she's noticed is a lot of teen girls experience developmental changes during quarantine. So like bodily changes. And so coming back to school and maybe looking different, feeling different about themselves has been very stressful and very anxious for girls. And having to be around their peers that might have also changed has been a very stressful thing. So girls might be acting anxious at school, maybe just be nervous to go to school at all. And I've noticed this with younger girls in my freshman advisory group. I am part of Family Club at St. Francis, where older students mentor the younger freshmen. And I've noticed that some of these girls, in the way that they feel nervous to kind of put themselves out there. And that could be possibly because of the changes that happened while they were at home and suddenly they're put on blast in front of all these people.
Thanks, Riley. As I said, and I know there are many parents listening, it's so good getting your insight on this. Dr. Escobar, wanting to hear more from you. I know you work with women with different socioeconomic backgrounds and status and employment status, and people from just different walks of life and races. And so how are mental issues and symptoms different when you are working with these different groups of women? Are there differences? How do you approach these different groups, knowing that for some groups there may be resources available and for others there isn't?
That is, I could actually be talking about this today and tomorrow and the day after. It's so much. But before I get into that question, I do want to add that the two previous with the two panelists, I completely agree with what they're saying, and this I'm seeing the same things because we do also provide services for young children and adolescents, or young adult and adults. And the other thing that I just want to add to that is that we've seen increase in grief. People have lost loved ones, and not only one, but it could be several people in the family that they have lost. In terms of your question about what I'm seeing in our clinic and with the women that I work with more low socioeconomic means, is they were already hurting, like I said before the pandemic. They were hurting to make it ends meet. And after that, they were seriously hit. Our population was seriously hit because many of them lost the jobs, and it's to the point that right now a lot of them have been unable to get back to the workforce. I mean, we're talking about some of these jobs that are, like in the restaurant industry, the cleaning industry, and hospitality industry. So those are the ones that we saw that were taking a huge impact economically, and those are the folks that serve those industries. So when it becomes a stress, you can imagine, right? Not only are they home with their children, trying to help their children with homeschooling, with many of them not even knowing how to use a computer or how to perhaps even read or write. We're talking about, and moms trying to find out where to get food. These are the folks, the folks that I'm working with, the folks are trying to figure out where they go get food, at the end of the day, to feed their families. They lost their jobs. And so I've seen in terms of mental health, because of that, the clinical depression rates extremely high, the panic disorders extremely high. I work in an integrative care setting, so physicians are able to call me when they have someone at their clinic, and they're in the middle of a crisis. So I have many crises going on, suicidal ideation and suicide and serious suicide gestures very high. And you're talking about a community clinic that is main role is primary care, right? But that's what we're getting on top of the fact that we have severe shortage of mental health providers. So how to help all these people that need the help immediately? It's not like they have time to wait 3 months, 4 months, be in a wait list to get a provider. So we've learned to try to be very creative, try to, if we see someone right there and then, try to help right there and then and do the most that we can. We don't know if some of these folks will come back because of the other responsibilities. But I've seen, for the first times, I've seen depression with psychosis. And that's the severity of what we're seeing, the stress level. And unfortunately, I'm also seeing a lot of it's very painful to say, but I had last year, a lot of child abuse reports that I had to myself make because of the incidents of abuse at home. So it is really, I really think we're in this critical moment. There is a crisis. And it's really hitting all of us, like I said before. But I think with the limited resources, it gets you to and limited resources I'm talking with is sometimes the supports that people had are no longer there. So you see a higher level of that, right? Yeah, so I'm committed to continue this work. But we're here for a long run. You know, some of our women are trying to go back to the workforce, and they're really struggling. And I'm wondering, what is that going to do, right? What is that going to do to the family?
Yeah, thanks. And Dr. Escobar, as I listen to you, of course, and maybe at the end, I do want to ask each of you, how are you doing, right? Because as you said, this is impacting all of us, and I can hear it in your voice as well. You know, you're treating and you're helping all these individuals and women, but I'm sure it impacts you as well. And so I think it would be good for myself and other attendees to hear that, because we're all in this together and we're all going through it in different ways. I do have a quick follow-up for you, Dr. Escobar. Were you seeing a lot of your patients still in person in the clinic, especially the first 12 months of the pandemic, when we had the most restrictive lockdown, or was there an online option, and was there a reduction in the number of women being able to participate in the clinical services?
Interesting enough, well, we were not set up to do telehealth, right? In our clinic. So we had to figure things quickly, like everybody else, within weeks, to figure how we're going to do this, and how we're going to make sure that mental health people had access to mental health. So no, we didn't. Answer to your question, no, we didn't do in person. We provided a lot of telehealth. We had to go through telephone, which is not your ideal, but it was something. And interestingly enough, we were serving a lot more patients. And I have a lot of theories because of that, theories for that. But we were serving a lot of patients, particularly patients that we were never ever able to serve because they didn't have the transportation. They didn't have the childcare. They were the care providers for grandma, to special needs kids. This is an actual case I have, a mom. And, so you have all those people in the home. How are you going to leave the home to try to get yourself some space to be able to deal with to address some of your own mental health? So we were able to get a lot of folks, and there was more consistency. It was not until probably 8 months ago that we went back, and now folks have the option to either do the telehealth or face-to-face. To my surprise, a lot of them are choosing the telehealth. And I guess in later questions, we can talk a little bit about how my hope is that we find the funding, and that funding stays put with telehealth, because that's going to be our future. And as you know, many of the community mental health programs that we have through Medicare, Medicaid, has been a challenge to really get paid for those services. So there's a lot of advocacy out there for that.
Thanks, Dr. Escobar. And Dr. Dami, I know you talked about, when we asked about the symptoms, you have seen an increase in substance abuse. And that reminded me of, and I don't have the data in front of me, but I know I've heard, and I've seen it as well among colleagues, where it's very difficult for women to talk about their stress, anxiety, and their mental health. Why do you think it's so difficult, and what can we do as a community to really encourage women to talk more about these issues and to seek the help they need?
Well, thank you for that question, Mayor. I did want to just add on briefly to what Dr. Escobar was saying. So El Camino Hospital actually increased its inpatient psychiatry beds during the pandemic, and we moved into a new building, and our bed strength went up from 24 to 36. And I do know I and several of my other colleagues continue to see patients in person, at least some patients in person, because patients with severe mental health symptoms or patients that were acutely suicidal, it was just really difficult to manage them through telepsychiatry appointments, although I'm really grateful for telepsychiatry. I wanted to also say that I actually asked my patients today, as I was talking to them in the clinic, about why is it so difficult for us to talk about stress, anxiety, and women's mental health. And one of the things that consistently almost everyone said was that women, there are just too many expectations of women. The culture wants us to be in this perfectionistic role, and to have it all together and take care of everything and do everything. And I think there's very significant generational societal pressures just make it really hard for women to themselves recognize their symptoms. So there's a significant minimizing of symptoms, that it's not just from the society. I think as human beings, as people, women tend to be very externally focused, take care of things, take care of their children, manage their jobs, and hence there is this really significant lack of recognition of stress, anxiety, and the toll that it takes. And the way to address it is to have conversations like this. This is the best way to reduce stigma. We reduce stigma by being compassionate, by recognizing that we're all human. We can all have issues. Sometimes some of us have more issues than the other, but it's okay. We can talk about things. We can treat things. We can talk about our darkest fears like suicide or contemplating suicide, and know that there are many reasonable and hopeful alternatives that are available. So I think the best way to begin to address these very significant difficulties for women is to have conversations in a non-stigmatizing, non-judgmental setting. And I want everybody who's listening to know that there are many, many resources, and it's okay. It's okay to feel stressed. It's okay to be depressed. It's okay to have thoughts of self-harm. We're here to help, and we can talk about things and talk through things.
Thanks, Dr. Dami. And as I was listening to you, and I know I served on the El Camino Health Care Board, but I'm curious whether or not you have an anonymous hotline at El Camino where women can call in and ask questions and get responses to any concerns or questions they may have.
I do not know, Mayor, I do not know if we have an anonymous hotline, but I do know that we have a number that patients can call for help. I believe it's a 1-800 number through the mental health services, and I honestly, I don't have it listed here, but once they call that number, they will get a call back, I believe, within a day, and somebody within the team will reach out to the person and help them navigate their needs. So help them, ask them questions about what they need, what resources they need, what resources are there, and then connect them with those resources. So we do have that for mental health services here at El Camino.
Perfect. Thanks, Dr. Dami. And I know at the end, Executive Director Adine Miller will be sharing useful resources for attendees. And if we don't include that 1-800 number, I'm sure we can get that number and maybe include it in a future email. Thanks, Dr. Dami. We received a question about social media, and it was also one of the questions we had for you, Riley. So I'm going to jump to that question. What role is social media playing for students during the pandemic, in this pandemic environment? To what extent is it helpful or not? And any tips for parents?
Yeah, I can tell you all about social media because I've been on it a lot recently. But I would say, honestly, social media kind of destroys childhood for some kids. Like when I was 12 years old, I know I spent hours outside. We have a trampoline. I'd be out there just like running around. And now I see 12, 13-year-olds on their phones posting photos of themselves, downloading who knows how many apps to fine tune the photos, and then posting them and anxiously waiting for like anybody, like even complete strangers, to just give them validation. And it's so unhealthy, and it's extremely sad that that young girls especially are looking to complete strangers for validation. And social media and the pandemic together have just magnified this, because the quarantine kind of lifestyle was maybe sitting at home a lot more, eating more, baking a lot, cooking. I think those were a lot of common activities. And that combined with looking at social media a ton, which has, everyone knows, Photoshop, Facetune, all these things can be so harmful for young girls especially. And so I think that social media has harmed a lot of young girls in seeing these kind of things and feeling that pressure to look that way when it's just so unrealistic. And even the people in the photos themselves have admitted it's not real. But that information is kind of getting lost in all of the likes and the comments and everything. And it's not getting back to the people that need to know that it's fake, which is the young girls that are being affected by it. And I'd say the positive side is the communication aspect of it. I've told my parents so many times, like, I'm not addicted to my phone. It's just how I talk to my friends. And I think that that's the positive thing of social media, is it's just how people communicate, how especially teens communicate these days. But I think that parents especially need to have those conversations with their teens, especially young girls, that what you might be seeing is completely unrealistic. And I think that boundaries need to be set to understand that this is not real and you're so much more than these kind of images that are being put out, and beauty has so many different layers to it than just what's being put on social media. And on the other side of things, I think that social media has been kind of interesting as we've been going back to school, because for students that maybe my school, we returned if you wanted to in the spring last school year. And so it was kind of half and half, were on campus, off campus. And I think social media was kind of, in a way, a pressure for students to maybe return to school when they might not have been comfortable, because students would be posting, oh, it's so fun to be back, or like hanging out with their friends when maybe some students were not allowed yet or maybe not comfortable. So I think that's also been kind of a pressure, is like to jump back into that norm again, just feel like you have to be back hanging out with your friends and doing everything that was pre-pandemic, when it's just not realistic for some people. And it's just a conversation that needs to happen between teens and their adults. Like it needs to be on a personal basis. It's whatever you're comfortable with. That's what needs to happen. And I think that that's kind of a boundary that needs to be set with social media, especially.
Well said, Riley. I do want to remind our attendees that if you have a question, please submit them in the chat feature. I see one attendee has her hand raised, and we're not taking live audio questions. We're asking attendees to please submit their questions using the chat feature. I'm going to go to one of the questions that came through the chat feature. And Dr. Escobar, I think you could take this question, but I'm happy to also ask Dr. Dami or Riley, but I'll start with you. It's a question about, the impact on Black, Indigenous, and people of color, women. What has the impact been? And of course, the last 20 months, everybody's counting. We've gone through so much as a country. And so with everything that we've all gone through the last 20 months, an attendee has asked, and I do think this is such an important question, have you seen a disparate impact or any differences in how COVID and everything else has impacted, Black, Indigenous, or other women of color?
I would say yes. I think we have populations, certain groups of population that either because we don't, it's the access to mental health it seems to be very, very, very challenging, and I think I think it really has to do with the types of providers that we also have, and the kinds of, can we be culturally sensitive to, or have cultural humility to some of these other populations that we serve? Are people comfortable with that? I mean, it has happened, so much has happened for our women of color this last couple of years. I mean, throughout history, but this last couple of years have been extremely challenging. And I have seen, again, in all those populations I'm talking to you about, I've seen an increase. I have an increase in all mental health issues. But I find that in some groups, there's still the access seems to be an issue. I know we work in a community where we have a lot of Pacific Islanders, for instance, that women that we try to outreach to that population, and there's still some challenges. we can certainly have a whole conversation about that. Why is that a challenge still, right? In this time when everybody needs that. And I think it really has to do with values, cultural history, beliefs, worldview. There's a lot more that perhaps that I wouldn't be able to answer that question, but I know that we still are pretty behind in reaching out to some of the populations that are that we see in our community and that they're hurting.
Thanks, Dr. Escobar. And Dr. Adami, I do want to come back to you and talk about available resources. You know, I actually jotted down. I was very surprised to hear that I think UNC and El Camino and possibly one other facility in the country provides this unique service that you do. And so if the demand, over the last 20 months has increased, I'm curious whether or not you can share with our attendees, what other non-El Camino UNC resources are out there for women and the community to share with other women that they can go to and utilize and take advantage of if they're not able to take advantage of the services you provide at El Camino. What other resources are out there?
That's a great question. I did want to give out that number that I had said. It's not 1-800. It's actually 650-988-8468. That's the number that anyone in the community can call and be connected with someone who can help them with resources. Now, in terms of this question, what resources are there for women in general? There is a really great website called Postpartum Support International. I'm specifically targeting my question to perinatal women here, but there is a great website, Postpartum Support International, and they offer a lot of free online support groups, a lot of support groups for dads, for moms that are dealing with losses in pregnancy or postpartum. They have support groups in Spanish. They also offer peer support. So that's one blanket, one big umbrella of resources for perinatal moms. Now, in terms of general mental health too, I think there are lots and lots of resources. One of the resources that I use, and again, this is for frontline providers, but specifically physicians, was through the American Psychiatric Association website. They have a great tool that helps assess physician burnout or healthcare worker burnout during the pandemic, and again, provides additional resources. The American Psychiatry Association website, I'm sure, also has a lot of resources for general people in terms of understanding what depression, anxiety are, what symptoms they have, and then again, resources that people can tap into. There are a couple other resources I want to give out that I gave out to a lot of my patients during pandemic, and I did use one of them myself. One was an app called COVID Coach, and it was created by the VA. And it was a free app, and it has some information about COVID, but the great part of this app was that it has a lot of other resources about self-care and health and well-being, and how to just do really basic, simple things to help yourself as you go through your day. And so that was one really good free resource. Another resource that I gave to a lot of my patients was NAMI, N-A-M-I, NAMI, or National Alliance of Mental Illness. Again, they had a lot of good free resources, legal advocacy, and other important information, talks, lectures for patients who are dealing with mental health issues. So just to summarize the list, American Psychiatric Association resources, COVID Coach, Insomnia Coach, National Alliance of Mental Illness. There's, of course, Supporting Mamas, and then Postpartum Support International. These are the top ones that came to my mind.
Thanks, Dr. Adami. And I remember when I was introducing you, and I'm actually trying to find the name of the board. I think it's Supporting Mamas. Can you briefly talk about that group and also share if you know of any local social groups for moms or other groups in the community A lot of the moms you have mentioned may now be moms. Well, they were going through their pregnancy and they're now be moms. So are there any social groups that you would recommend for moms or even women who are currently pregnant? Because as you know, we're still very much in a pandemic.
Yes, definitely. And I do think that we're going to continue to see the effects of this pandemic for some time to come. So yes, supporting mamas gives information and support for families that are experiencing perinatal or depression, specifically focusing on the South Bay area, and they just help new moms and expectant moms deal with symptoms of depression and anxiety. So we have they offer free support groups, and I think their website is supportingmamas.org. They also have on their website, they have information about facts on perinatal depression and anxiety. In terms of new mom support group, one that comes to mind is Blossom Birth. There is also an organization called Family Tree Wellness that offers different types of support groups for new moms. These are the two that come to my mind right now. So Blossom Birth and Family Tree Wellness. And I'll keep thinking more, and if more come, I'll put that in the chat too. I also think local faith communities can also offer a lot of support to moms during this time frame.
Yeah. Great points, Dr. Adami. And as I said earlier, we will be providing a useful resources link and information to all the attendees. I'm sure Dean will include these additional resources you mentioned. I do want to stay on the resources support topic and come back to you, Riley. What role can and should friends play to support their friends that are struggling in school? And I will expand that to say not just friends, parents, teachers. And as someone who serves on the CHAC board, I know CHAC is a huge resource for our community, and CHAC works with our schools directly. But what else can friends, parents, teachers do to really support our kids who are struggling?
Yeah, before I jump into that question on the kind of technology resource side, I work for an app called Liftly on their teen advisory board. And it's basically a mental health app. And one of the main features on there is a kind of community chat center where users of the app can post anything they want, from cookie recipes to maybe I've seen posts about anxiety tips or really anything, and other users can respond and provide emotional support. And so that's an app that I've been a part of and kind of helping develop. I can put the name in the chat later if anybody was interested in it. But on the technology side, that's been a support thing that I've seen be really useful for the users on the app. In terms of your question, one of the things that I've seen recently and actually kind of experienced myself is healthy boundaries with friendships. And I think that girls especially feel sort of an expectation and an obligation to really maintain and constantly check up on others and their relationships. And this is something that I've personally struggled with, is kind of finding the boundary between my own personal well-being and helping others too much. And on one of the other panels I spoke on, I forgot who it was exactly, but someone used the analogy of an airplane and your oxygen mask. They always say, put yours on before helping others. And I think that's totally applicable to this situation. I think that you need to help yourself before helping others. And I think that's super important with friendships, especially now when people are in kind of different places with the pandemic. So friends can be a really great outlet, but make sure, I would say for teens, if you're going to use your friends as an outlet, make sure it's a healthy kind of relationship. It's not one where you're putting in more than you're getting back. And with family, I think something important to kind of recognize is that everyone might be in different places with their families after the pandemic. It was a lot of time together, a lot of close contact, maybe more uncomfortable for some than others. So I think that recognizing those boundaries and maybe people recognizing that people might need different space is important. So that's something that I've kind of experienced with my friends and kind of personally.
Thanks, Riley. Dr. Escobar, speaking of resources, not only at Ravenswood, but maybe at other CBOs or other nonprofit organizations, are you seeing a staffing deficit or a reduction in funding over the last 20 months? And if so, how is that impacting how Ravenswood and other organizations are providing the service, which we've been talking for an hour now, and it's clear that this is a service we need in our community?
I haven't seen in terms of reduction of funding. What I have seen is more the reduction of the providers that are doing the frontline workers that are doing the work, and it does make at least for what I have observed is, you have, and you mentioned it before, you were talking about, how do we take care of ourselves, right? Well, we let's not forget that this pandemic has affected all frontline workers ourselves. So then we have our own losses, right? Our staff has their own losses. Our staff has their own mental health issues. I've had a lot of staff, a lot of colleagues, a lot of folks that have come to me confidentially what they're dealing with, in terms of their own depressions, in terms of their, anxieties, the burnout. Most of us have been working longer hours, and probably to accommodate for the influx of patients that are coming in, but also to help out the folks that have not. A lot of the folks that have been impacted, a lot of the women that I work with had to stay home, had their own children, the young children to take care of. They had the child care issue. So some of us that we were not in that position, we kind of step up and kind of and really helped out. And so some of us are taking much more different times, and it's been very challenging. So with less folks out there, for less providers and more burnout, that's what I've seen. I think, but in terms of the funding, and I don't know if I would have all the information at my level, but I haven't seen that. I have seen my partners, in the community, in the county, also being having an influx of patients, having an influx of need, and trying to serve as many people as possible. On the good side of that, though, I think I always think there's something that's coming. We have to look at some of the stuff that's coming up that may be very positive for us. And I find that we have a lot more collaborations and partnerships going on. And it's really interesting because we found out as professionals, as leaders, that, we need each other more than ever. And we have to be able to just say, okay, I'll work with you. No, I'm really going to partner. And this time I see people picking the phone. Hey, how are you at capacity? What do you have? This is what we have. Should you want to do that? We take care of this, reaching to each other. And that's the kind of thing that makes you say, okay, let's move, let's keep going. We can do this, for those of us that are out there and doing this work.
Thank you, Dr. Escobar. And I have one last question. And of course, I don't know if our attendees have any more questions to submit. And this question I'll ask each of you, and then I'll give each of you 1 minute to close. It is 8:12 and I'm trying to keep us on time. And Dr. Dami, I will start with you because one thing that's striking for me as I listen to all of you is the fact that, this issue is still very much with us. And I think a lot of people thought, with increased testing, vaccines, now, kids ages 5 to 12 can get the vaccine, everything would go back to normal. And we wouldn't have, mental health impacts on our community. And that's not what I'm hearing from all of you. So Dr. Dami, I would like to start with you about, where do we go from here? Do you see things getting worse before they get better? Is there anything that we can do to help to stem this? What do you see, if we're all pulled out our crystal balls, what do you see, Dr. Dami, in the future when we talk about the impact on our mental health from this pandemic?
So thank you for that question. I'm generally a very optimistic person. I do see the ramifications of this pandemic lasting for times to come, especially as I work with young moms who are giving birth or are pregnant or who had COVID during pregnancy. That being said, I think I want to really underscore one thing that stood out for me as I worked through the pandemic. I didn't have a day off. This just landed on us, and that's how it happened, and that's how it rolled. Um, but I think one thing that I would really like to say is for all of us to really embrace the concept of trauma informed care and trauma informed work, no matter where we do it, because I think this has been a deeply traumatic event for all of us. And so to really focus on safety, trustworthiness, collaboration, to be transparent in things that we do and say, to empower each other, to be aware of compassion fatigue, to be aware of, you know, first-hand trauma and vicarious trauma. I think that is what, in my opinion, is going to help us mitigate some of the adverse effects of this pandemic on women's mental health. So my vote is to really focus on trauma-informed care, trauma-informed approaches wherever we are, whatever we're doing, to be really empathic and to cooperate at multiple levels. And I saw that unfold during the pandemic as I worked here at El Camino. I saw our administration reach out. We actually set up a way to provide free therapy for our healthcare providers. So there were many things that were positive that happened. But as I look ahead, I do think the ramifications are there, just like they're there for any stressful event. People took years to recover from PTSD of several past events. I think this will take time too, but I do see a lot of hope as I look through the crystal ball.
Thanks, Dr. Dami. I like your optimism, but you're also being a realist. Riley, you mentioned a lot of your friends and girls were also getting ready to apply to colleges. During the pandemic, a lot of girls were going through, what many teenagers go through. And so I'm curious, looking, in your crystal ball, what do you think the long-term impact of COVID will be on these teens? And is there anything as a community that we can help to support them starting today?
Yeah, I would say on the positive side, actually mental health has been more talked about in schools. And I've noticed this in my school. We recently had a bomb threat, and the next day, all the teachers in my classes all took time to check up on the students, how we were doing. So I think and mentally, and how the event affected all of us. And pre-pandemic, I think that it might have been a little bit handled differently. So I think on the positive side, the pandemic has had us focus on self-care a lot more. However, I think that that message of focusing on self-care needs to come from the top down. And whether that's bosses, parents, teachers, administrators, whoever it is, I think teens and really anybody needs to hear from the top down that self-care is very important, especially coming out of the pandemic. And I think going forward, especially for students, hearing that message from people that we trust and respect and look up to, it's going to change a lot going into the future. So the one thing I would say is I think that all the adults and people in power today that have a voice need to really use that voice to stress that self-care and mental health is becoming increasingly important, especially coming out of the pandemic.
Thanks, Riley. And we got a question from an attendee, which I think is a great follow-up to your point, Riley, which we are talking more about mental health. I agree with you at all different levels. And someone asked about the Mental Health Service Act that apparently has funding for mental health services, and the attendees asking whether or not the panelists have heard about this act and if there's funding available from this resource. Anyone? And I can see all three of you. So if you want to take this question, is anyone familiar with the MHSA, the Mental Health Service Act?
When I was at, yes, I am familiar with that, and I know there is funding with that. Um, I am, but what I'm not familiar is in what categories some of this funding could go. I think one of the things that we have to remember is that we do get different types of fundings, and different types of fundings go to different categories, right? We have fundings that go particularly for people that have severe mental illnesses, and then funding that not necessarily for that, more prevention work. So I'm not sure exactly where we're at with that mental health with MHSA in terms of that.
As Dr. Escobar. And so if that's another useful resource link, Adine, maybe we can include. I don't know, I'm not familiar with the ACT either, but definitely, you know, if there's funding out there to support these mental health services that are being provided in our community, we want to be aware of them and take advantage of them.
Absolutely.
So thanks to the attendee who mentioned that. So Dr. Escobar, we heard from Dr. Dami about, you know, in her, what she's seeing in her crystal ball, or what she's predicting when it relates to expecting moms, new moms, and just with postpartum depression. And also from Riley with regards to teens and our kids in school. And so I'm curious, just from a broader community perspective, and the patients that you see every day. You know, in your crystal ball, what do you see? And is there anything we can do to help as a community, as individuals, to really stem any negative impact or ramifications from COVID?
Yeah. Well, you know, first of all, I wouldn't be in this business if I didn't have hope. Hope carries me every day. So I do. I know it feels overwhelming at times, in just being quite frank and candid. It feels very overwhelming. I'm sure I'm not the only provider out there where sometimes it feels like, oh my God, I just it's you know, someone that's homicidal, someone that's feeling suicidal, someone that's in the middle of a crisis, and you have that back to back, and then traumatic experiences is very tough. I do see a lot of positives coming out of this pandemic. I know we still have a long ways, but I do see that we have learned mental health. There's lessons learned here. The whole idea of some of us not being ready, for instance, you know, with telehealth, you know, that would have been a good thing for us to do. Well, now we're being almost like it's a catalyst. Yes, we have to do it. It's important. This is access. We all talk about access to care. Well, this is an opportunity. This is an amazing opportunity to have this. It's an opportunity also to look at our patients that are more in the low socioeconomic side of things, and say, okay, how can we help them with that technology? And it just, you know, I sit sometimes in my office, and we're in the middle of Silicon Valley here.
Mm-hmm.
And this person doesn't have a laptop, this person doesn't have a phone, this person, I'm like, okay, that we can do something about that. I know we can. How? Well, I don't have all the steps, but I know we can. I know we've done many little projects here and there in our community, in our organization, where we sat down and taught people how to do 1, 2, and 3. How do you access your provider through this? What can you do? And regardless of age, because people would say, well, you know, it's an older senora, you know, she's 80. No, she doesn't know. No, we have to stop that. Everybody has the ability, if with the right training, the right type, and the right equipment. So we've learned that. We've also learned that there's some more creative ways to provide services. For instance, yes, we have a shortage of providers. Well, we'll look at some other fields, right? Let's look at, can we do cross states? Can we do some of that? Some states have more providers than others. Right now, it's been a bit, I know that with in psychology, it's been very huge that you just provide services in that state. So are we looking at that? Are we having those conversations? So things opened up for those conversations. And the major one, a couple of major ones that I've just heard from the other panelists is really the wellness component, the idea that we do self-care. For me, is not even a luxury anymore. It's a necessity. Self-care is really a necessity. And how do we do that for our moms, for all these women that have multiple things going on and juggling? By the way, multitasking doesn't really work. Some people think it works.
Don't say that, Dr. Escobar. Please don't say that.
No, okay, I'm just gonna say that, leave it alone, because a whole new section of multitasking. So, focus the present, the today, the now, what, and have a moment to have that self-care, whatever that is, because with our community that we work, they have the limited resources. Actually, I mean, they're so limited that we have to really think outside the box. How would that look like for this person that can't even go outside the community because there's violence? I can't ask her to go for a walk. That's putting this person in danger. So what else can I do? The home is overcrowded. What else can I do? It forces us to think outside. It forces us to say, okay, I learned all this in books, but you know what? This is life. How do we help this community? It allows us for more creativity, and that comes from all my providers. That as we sit around the table, I see the more the sense of creativity. I see the sense of, let's help each other, not only within an organization, but out in the community, like I said so before. The wellness component, the trauma informed, we got to bring that in. We got to bring that in our settings. There's a lot of lessons learned. There's a whole list of things like that we can go ahead and really learn and say, what can we do? Where do we move? Anyway, I hope that answers that question.
No, it does. It does, Dr. Escobar. And, I'm just going to do the final thought question. But as you were talking about self-care, it made me think of another question I'll ask each of you. It's, and maybe it is self-care, but what do you do to cope? We know you're all going through a lot, just like many of us. And so, Riley, I'm going to start with you. 1 minute, question. What do you do to cope and manage all of this? So maybe a teen young lady listening will learn something. And then what's your final thought?
I would say my number one thing to cope has been spending time outdoors. Especially, I've really enjoyed going on walks. We got a COVID puppy, so I've been doing a lot of walking.
So many families.
Yeah, I know we're one of many, but I've been doing a lot of walking with her. But one of the things that I've appreciated about going on walks is I've noticed things about my neighborhood that I haven't noticed before. And I usually like to go on walks, sometimes by myself. And those times have just been a chance for me to reflect on everything. And I think that's something that's really helped me through this, is taking time to myself, whether it's on these walks or in my room or whenever it is, just to kind of reflect. Because like I said earlier, everything teens have been thrown at us within 1 week. Everything started up. So just taking a time to be away from all that and just think about everything that I've been taking on, teens have been taking on, just being like, this is a lot, and recognizing that and congratulating myself in a way, and just being like, I've been doing a good job. And I think that that's something that everyone needs to recognize, is we're doing the best we can. And so my final thought would just be, I think there's a lot that we can learn from this pandemic, and a lot that we've learned about ourselves. And I think that we need to take the positives of that. And I know it's so easy to think about all of the stressors that have come out of it, but also thinking about all the positives. I've learned so much about myself, and I've learned self-care things that I've found that work for me so well. So I think focusing on those things rather than the negatives can really help a lot coming out of the pandemic.
Well said, Riley. Dr. Ajabi, what's the one thing or one of the things you do to cope and manage it all? And then a final thought.
Yeah, so in terms of coping, I'm a swimmer, and I'm so glad that the pools opened up. I was really sad when the YMCA Mountain View closed down for swimming, but they opened up, and I think the heavens were smiling, and that was one blessing for me. I also joined a hiking group, and interestingly, it was a hiking group with physicians, and it really changed a lot of my perspective, because we walked and we talked about all the difficulties that we face, the loss and grief, and the deaths of our patients, and that was quite helpful and very therapeutic, and I made some great friends in the process. I also think spending time with my teenagers was very, very lively and interesting and helpful. I also want to point out that there's one self-care thing that I did, and I think it would be amiss if I don't say it out here, but I see my own therapist, and that was something I kept doing through the pandemic, and it really gave me a big perspective. My own family in India was deeply affected by COVID. My parents contracted it, as did my brother, and they fortunately were okay. But I think that was a tough time in terms of managing patients and having family far away. And then my colleagues were very supportive. El Camino Health was very supportive. Our CEO, our chief medical officer, was just amazing in terms of their help and support. So I think what my final thought is that there is a lot of help and support out there. We just have to let people know how we're doing and if we need help to reach out and speak up. And that's one thing I would encourage everyone, from my patients to my children to myself, is reach out for help. Say it. If it's too hard, say it, because believe me, it's hard for everybody, but we'll get through it, and we'll get through it together.
Thanks, Dr. Adami. So we heard from Riley getting outside and getting a new pet from Dr. Adami, exercise and making new friends. Dr. Escobar, 1 minute to share what you're doing to cope and manage, and then a final thought.
Okay, thank you. I ended up rescuing another dog, of course, and that's kind of what I do. So Riley, we're in the same boat here. I'm a runner. That really helps, running helps. But the most important thing that has been very helpful, and this happened through the starting of the pandemic. My father did end up contracting COVID, and he passed away from COVID. And in honor of him, I started my spiritual journey. And it's been an amazing experience with some guidance, with some help from folks that are in that spiritual world. And I found that gave me peace and a sense of happiness. So what I can tell people, very short, I'm going to make this very short, is that find that where's your peace, where's your sense of happiness, whatever that is. And if that's a new puppy, is that therapy, is that connecting to something bigger in this universe, running, whatever that is, you just have to find that. But we have to take the time to look for it. It's not just going to come. And that's my last thought.
Thank you, Dr. Escobar, and I'm sorry to hear about your father, but that is the perfect final thought to end this program. Thanks to all of you. Thanks to our attendees. I will turn it over to Adine to close the event, but it's been my honor and privilege really talking with all of you and learning from all of you today. So thank you.
Thank you, Mayor Flagger. This is amazing. I'm in awe of the panelists. Mayor Flagger, I'm in awe of your moderation. I took notes both on the content and the style. So thank you for the authentic conversation from all four of you. I want to do a real quick sort of summary and sort of talk about sort of like our next steps with this. So I took notes. I'll throw this in right now into the chat. I actually copied all the URLs that were mentioned. They're collected right here in a Toby, if anybody cares to find a new tool to manage your multiple tabs in web browsers. I want to thank both the staff that work for me and the staff that work behind the scenes for other organizations to bring this to fruition. There's lots of people that were involved in making this happen. Real quick thank out to Dr. Dami, Dr. Escobar, Riley, Mayor Flagger, our partner, Los Altos Women's Caucus, and then our core sponsors who I mentioned at the beginning. We will be making available a recording of this both in English and Spanish if we got our toggles right. Elena has been translating in Spanish. She can wave if you can see her. And so you'll be hearing her voice there if you want to care to listen for that. We do actually want to get feedback as well. So we are running a very quick survey. You've basically got until noon tomorrow to fill it out. And if you participate in the survey, you get a chance to get a $500 grant to or selection. You can make a grant to a local nonprofit of your choice if your name is drawn. And then I'll just, we'll send that survey chat out by email as well as posted here in the chat. I think Hank already did that. And then, as I mentioned, I'll follow up with a blog post, including a recap of the conversation as well as the resources that were shared here. We will have our next session. It's tentatively scheduled in February, the first week of February, focus on childcare and elder care. And then we will tentatively close out this series and sometime, I think probably in April with the conversation about workforce and employment. So thank you for this. Thank you for being a part of this. This has been tremendous for us. And I think it's a tremendous learning opportunity. I'm actually excited for some of the things that we've heard and the opportunities for us to move forward. And with that, I will close out.
Thank you.
Thank you. Good night, everybody.
Good night.